With Trump's big, beautiful bill now on the brink of becoming law, a growing number of seniors across the country are speaking up. They're deeply worried about Social Security, Medicare, rising taxes, and desperately want their voices heard. So today, we're diving straight into what Americans are really saying. We've combed through hundreds of comments, some from viewers on this channel, others from across the internet. These are real words from real people, some who support the bill, others who are outraged, and many who are simply trying to understand what's happening. I'll be reading these comments in full, then offering context, insight, and honest analysis. Whether you're retired, still in the workforce, or trying to figure out how this bill might shape your future, this conversation is one that directly affects you, and you deserve to be a part of it. Let's begin with this powerful comment. Speaking for millions of people, please don't let this big, beautiful bill pass. It will mean cuts to our health care and to food stamps. These are what keep us alive. Do you not care about the elderly? About our children? The disabled? Would Jesus approve of this? You claim to follow him, yet you pass this bill? You can't call yourselves Christians and support this. This one hits deep. The urgency is raw. The fear is real. This isn't just a political disagreement. It's about survival. For countless seniors, health care and food assistance aren't extras. They're essential to staying alive. And when people tie those fears to their deepest values, like faith and morality, you know the issue runs far deeper than party politics. For many older Americans, this isn't a left versus right debate. It's about being able to afford groceries, see a doctor, and care for their families. Here's another comment that came in strong. People think this only guts Medicaid. It screws up the entire insurance marketplace. If you're 60, married, making $80,000, and on the marketplace, your premiums are about to go up by 400%. You could end up paying $26,000 more. Millions will lose access to health care. This one stands out for how direct it is. And though the language is blunt, the concern is legitimate. Let's unpack it. If you're nearing 60, not yet eligible for Medicare, and make too much for Medicaid, but still not enough to comfortably afford private insurance, you likely depend on the ACA marketplace. The Senate version of the bill reportedly rolls back expanded ACA subsidies. And when those subsidies shrink or disappear, premiums shoot up fast. For many, the estimate of paying $20,000 to $26,000 annually isn't an exaggeration. Insurers adjust rates based on subsidies and risk pools. If fewer people buy in and protections weaken, costs spike, especially for older consumers who already face higher base rates. So when the commenter says the whole marketplace could collapse, that's not fear-mongering. It's a serious warning. Now let's look at this next comment. What scares us most is our Social Security checks. We can't afford to have them cut. Many of us are living paycheck to paycheck just to keep the lights on. We need every penny of that check to survive. And Medicare, it's our only way to get medical care. We need both Medicare and Medicaid. That's a straight-from-the-heart statement. If you're retired or nearing retirement, you know how fragile the monthly budget can be. For millions, Social Security isn't pocket money. It's the money for rent, food, and basic utilities. And Medicare? It's often the only way people can see a doctor without going into debt. This comment reflects a quiet but growing anxiety felt across the country, especially among those living without financial safety nets. It's not alarmist, it's reality. Here's another thought-provoking take. I support President Trump and this big, beautiful bill, but I want to see Social Security go untaxed, and maybe even an increase for seniors. I haven't read the full bill, but I've heard the middle-class tax cuts only last until 2028, while the rich get permanent breaks. I've supported Trump since the beginning, but we need more for retirees. God bless America. This is one of the more measured responses. This person supports the president and trusts his leadership, but still wants answers. And that's healthy. Democracy needs people who ask tough questions, even of leaders they support. Their concern is valid. If middle-class tax cuts are temporary, but breaks for the wealthy are permanent, is that really balanced? That's not an anti-Trump sentiment. It's a fair critique. Support doesn't have to mean blind faith. People want meaningful outcomes, not just rhetoric. Now, let's get into one that pulls no punches. That $4,000 deduction, total bait and switch. They promised no tax on Social Security, but didn't deliver. Any politician who votes against a clean bill will face backlash from seniors. Republicans knew about the Byrd rule before the election but lied on TV. This could be voted on weekly until it passes. I worked 50-plus hours a week for 50 years. We shouldn't be taxed on our Social Security benefits. That's double taxation, plain and simple. This comment is packed with emotion, and frankly, many Americans feel the same way. There was a clear promise, no tax on Social Security. But when that turns into a limited deduction with conditions, it does feel like a betrayal. They mentioned the Byrd rule, a Senate rule that blocks certain provisions, like full repeal of Social Security taxes, from being included in budget bills unless they meet strict budgetary standards. Lawmakers knew about this constraint in advance, yet still made promises. And on the idea of double taxation, they have a point. If you spent 50 years working and paid Social Security taxes every paycheck, it feels unfair to be taxed again when you finally receive the benefits you earned. For seniors living on fixed incomes, that extra tax hit can be devastating. Now check out this insightful critique. I don't get how someone earning $150,000 can still get $25,000 in tax-free tips, but seniors start losing a $6,000 deduction at just $75,000. I have bills too: mortgage, insurance, food, property taxes. Why does their benefit last longer? That's an incredibly sharp observation. Why are higher earners getting such a long runway for tax breaks, while seniors lose theirs at half that income? This is the kind of detail that may seem minor on paper, but it matters enormously in real life. If you're retired, every deduction counts. Losing a $6,000 exemption while others get $25,000 in benefits? That doesn't feel balanced, and for seniors trying to stretch every dollar, it hits hard. Now for a more intense one. This bill will hurt seniors and children. The next decade will be devastating for America. This isn't a beautiful bill. It's the downfall of the country. This bill does not help Americans. Yes, this may sound dramatic, but that level of fear is real. When people feel like their lives are being shaped by lawmakers who don't understand what it's like to live on a tight budget, it sparks real panic. This is fear, not just anger. Fear that the system is no longer looking out for them. Here's a more historical perspective. I was a senior in high school when the national debt crossed $1 trillion. In 44 years, we've added $38 trillion. Now, we're overspending at $2 trillion a year, even with this big, beautiful bill. That's the voice of someone who's been watching policy evolve for decades. When you remember a time when $1 trillion seemed like the peak of government spending, today's numbers can feel overwhelming. For people who've lived through multiple recessions, inflation waves, and deficit surges, this is exhaustion talking. People want some semblance of fiscal responsibility and stability. Now let's address a common misconception. The big beautiful bill cuts Medicare. Actually, That's not accurate. The current version of the bill does not make any direct cuts to Medicare or welfare programs. It doesn't reduce Medicare benefits or lower federal spending on these services. But, and this is important, just because Medicare isn't being explicitly cut doesn't mean there aren't consequences. Indirect impacts, cost shifting, administrative delays, these things still affect how people receive care. So while it's true that Medicare isn't being slashed, the anxiety about ripple effects is still valid. Finally, this comment captures the raw frustration of the working class. Everyone talks about tax cuts. I'm a blue-collar worker. I'm not seeing one. By June, all my forced overtime is just going to taxes. I'm not making any extra money. I'm angry. And rightfully so. This isn't about political parties. It's about fairness. You're working long hours, sometimes mandatory overtime, and yet you don't see any financial reward for it. When people are celebrating tax cuts and you feel none of it, it's frustrating. And here's the deeper issue. This bill also includes new work requirements for public benefits. That means more pressure on those already working low-income or unstable jobs. So if you're working hard and still don't qualify for help, or still don't get tax relief, it feels like you're being punished for doing the right thing. Even worse, overtime is taxed like regular income. And if it pushes you into a higher bracket, you're paying more in taxes, even if your take-home doesn't change much. That's why so many workers feel squeezed, like the system takes more than it gives. So what are we seeing here? People are paying attention. They're not just scrolling past headlines, they're reading the details and speaking out. And seniors, especially, are making their voices heard. Whether you're for or against the big beautiful bill, these concerns are real. These are everyday Americans trying to navigate an increasingly uncertain future. Subscribe, like, and comment.